pandemic is behind us. But some countries fared better than others. A quarter of the global population never received a COVID-19 vaccine, with poor corners of our planet left abandoned.
I want to find out what impact this has had on global South nations. So I've come to Senegal, on the west coast of Africa.
Only 1 in 10 people here are immunised for COVID-19.
We need a more equal system. It's like a right. It's like a human right.
In future pandemics, developing African nations like Senegal want to save the continent by producing vaccines themselves.
Pour lutter contre les épidémies. C'est ça notre ADN. Et donc c'est notre seul objectif aujourd'hui, c'est de produire en Afrique pour l'Afrique.
In episode 1 of a special series about pandemic preparedness, we explore if a new global treaty can fix vaccine inequity. So let's flatten the curve. At this community clinic on the outskirts of the capital Dhaka, babies are being immunised for a range of childhood diseases. Vaccines are free for all citizens here in Senegal. But during global health emergencies, African nations struggle to access medicines and supplies quickly. The clinic's head nurse, Muhammadu Mbe, says vaccine inequity was glaringly obvious during the COVID-19 pandemic.
Parce que vraiment, c'est ça quoi. Vraiment, crise bi amone, nga xamni y avait des morts partout dans le monde, amone jaxlé ak jaxré, vraiment ci vaccin yi retard bi amone. Mais il y avait des morts, il y avait surtout par rapport aux personnes âgées.
With its young population, the death toll from COVID here was not as devastating as in ageing industrialised societies. But the pandemic challenged Senegal's underfunded, understaffed health system.
Parce que les moyens qui manquaient, parce que vous voyez, la prise en charge, vu le plateau technique, le plateau médical ici, même dans les hôpitaux du Sénégal, on n'avait pas assez de place, surtout les réanimations, pour pouvoir vraiment faire la prise en charge et sauver des vies.
It's why Nurse Mbe wants Africa to be better prepared for future pandemics.
What do African nations need?
Leçon sur la Covid, prépare def ay moyens, fekkee par rapport vraiment ak vaccination ñu fexé ba mëna am ay centre de production AstraZeneca te doon non AstraZeneca jotatuñ ci.
Nurse Mbe says poor immunisation rates are also due to misinformation.
Rumeurs yi nga xamni si on a reçu des vidéos par les réseaux sociaux yo xamni dañ ci wax ci par rapport ak vaccination contre la Covid yo xamni on dirait que vraiment ça a empêché d'avoir des enfants, ça a réduit la durée de vie, c'était du n'importe quoi. Des vidéos aussi l'Occident là peut-être introduit ça pour diminuer la population africaine.
Moussa Diani grinds a living in the fishing industry, the main source of income for many Senegalese villages. When the pandemic hit, he wanted the vaccine.
So, are you vaccinated?
No. Vacciné wu ma ndax xam nga rek da nga dem hôpital gars yi ne vaccination yi jeex na moo tax ma jëw ma vacciné wu.
He now questions the need to get vaccinated at all.
Tiituma ndax xam nga la tiituma fii moom feebar moom macha allah yàlla moo si jàpp lu si ëpp moom duñu dal te yow gisoo sa benn mbokk buñ la ne kii feebar na comprendre nga léegi nag après te gisoo kenn ku dee sa kanam nii ñu ne lii moo ko rey comprendre nga après yow suñ la bëggee gëmloo ni kurit.
Such attitudes are lethal in Africa, where a deadly Mpox outbreak in 2024 has been declared a public health emergency. Some of humanity's most devastating diseases have ravaged this continent, spreading among the unvaccinated quickly in crowded cities and across porous borders. Precious Matsotso has led the South African Health Department and various global health bodies.
Africa is the most vulnerable continent in a sense that it has disease outbreaks happening all the time, and it is for that reason that Africa has to be the center and also an area of priority for the World Health Organization.
They call it Cafe Tuba.
Cafe Tuba.
Yeah.
I'm trying the local coffee with Dr. Sheikh Ibrahima Nyang, an anthropologist who has studied the impact of HIV, Ebola, and COVID-19 on West Africa.
It's strong. Whoa, it's very
Packs a
strong.
punch.
And
He believes vaccine inequity, along with the frequency of outbreaks here, has led to a distrust in Western medicine.
not only fatigue, they may think that there is a financial plot behind. So the issue of who is making the profit. The colonial process was very traumatic. It is in the memory of the population. They don't trust the system.
Dr. Nyang says anger intensified among Africans because they felt abandoned by the West.
Does it make you mad?
Yeah, of course. It makes me mad. Because like, we are all in danger. People are dying like hell. If you don't have the money, if you are not in the West, you cannot have. It makes me very mad. This is why I am among people who are fighting in Africa for Africans to make the vaccines.
1 year into the pandemic, when life-saving medicines became available, wealthy nations looked out for themselves, stockpiling vaccines, then controlling the bulk of supply. Health regulations meant to govern international cooperation were weak and completely ignored. Professor Suri Moon is a leading expert on global health policy.
When push comes to shove, countries really are on their own. You really saw that the wealthiest were best protected in the world, and the poorest had almost nothing.
African leaders call this act of self-interest vaccine apartheid. But those who advise Western governments on disease control say it's complicated.
I think it's probably unhelpful to label it as, selfish. There's a real tension that we need to recognise between sovereignty and solidarity. Governments are voted in by their populations to protect that population, and so they may see that their key mandate is protecting our people, and everything else is secondary.
We also had these...
At the time, the creator of the Oxford AstraZeneca vaccine called on the UK government to donate surplus COVID-19 jabs to vulnerable populations in other nations.
For most wealthy countries, we'd gone from no protection to very high levels of protection, so that the chance of someone going to hospital or dying from COVID-19 was near to zero. And if you focused vaccines on older adults in the world, many lives could have been saved in poorer countries. So I think that inequity actually prolonged the pandemic, because it meant that countries had to stay shut down for longer. They're vulnerable and were still at risk for a longer period of time.
1.3 million lives could have been saved if COVID-19 vaccines had been shared more equally, according to a study based on data from 152 nations. Dr. Michael Ryan, the deputy head of the World Health Organization, led the team responsible for the international containment and treatment of COVID-19.
Their ability to distribute countermeasures, the drugs, the vaccines that would save lives, was ethically challenged. We were not able to distribute to the people who needed those interventions most in the time it would have made a difference to saving lives.
To combat this inequity, Senegal is building Africa's first high-volume vaccine manufacturing hub called Medhavi. The Institut Pasteur de Dakar, a local private foundation, is steering this $250 million project. Showing me the new building site is Medhavi's manager, Lamine Sen.
Puis également, nous développons une large capacité de production qui nous permettrait aujourd'hui d'atteindre jusqu'à 1 milliard de doses en cas d'épidémie.
When it begins full operation in 2025, Medhavi will service all of West Africa. 4 other African nations are building similar hubs. Why is it important to have big manufacturing plants like Medhavi?
99% des vaccins qui sont utilisés en Afrique sont aujourd'hui importés. Et aujourd'hui, ceci nous met dans une position de vulnérabilité. Puis également, c'est difficile de contrôler le prix si on ne le produit pas. On parle beaucoup d'autonomie alimentaire, mais il y a également l'autonomie sanitaire.
At the Institute's main headquarters in downtown Dhaka, scientists have been studying infectious diseases and producing affordable yellow fever vaccines for 80 years. Now the Institute wants more funding to look into other viruses that plague Africa.
Travailler sur la vaccination de routine, mais également développer les capacités de recherche et développement qui vont permettre demain de pouvoir travailler sur des vaccins qui ne sont pas aujourd'hui rentables, alors que ces maladies-là restent des menaces pour nos populations.
Africa consumes a quarter of the global vaccine supply. It's a market expected to grow to about $2.5 billion by 2030. While there is enormous demand, the continent needs greater technical and financial support from industrialised nations and pharmaceutical companies.
Partie des produits pharmaceutiques les plus compliqués à réaliser. Il faut une attention bienveillante de la part des industriels occidentaux. Ils ont aujourd'hui les capacités techniques, ils ont aujourd'hui les ressources humaines, ils ont aujourd'hui les moyens financiers.
The 5 African hubs hope to meet 60% of the continent's vaccine requirements by 2040.
I do think the African scale-up is a good thing. It's extremely challenging. You have to not only put the buildings in place, you've got to train skilled workers, and we might have to keep those buildings warm for 50 or 100 years before the next pandemic, or it could be next year.
Who knows whether the vaccine for the next pandemic will be developed in the south? This isn't about charity. This is about collective security.
Geneva, the health capital of the world. Since 2021, it's also been the centre of intense negotiations to create a better system to manufacture and distribute vaccines, so nations like Senegal don't get left behind. At the World Health Organization, 194 member countries are trying to draft an agreement that helps the planet prepare for, prevent, and respond to future pandemics.
So why is a pandemic agreement important? We're trying to make international rules that are fit for the threat of pandemics in a globalized but also a less unequal world than we had a few decades ago. I do think it can deliver a much more equitable and effective response to pandemics in the future.
After 2 years of negotiations, the WHO was due to finalise the agreement at its annual assembly in May 2024.
I know that there remains among you a common will to get this done. And no one said multilateralism was easy. But there is no other way.
But they couldn't agree on a final treaty by the deadline, so talks were extended for a year. Are you disappointed about the missed deadline?
Yeah, I have to say I'm disappointed. This is a negotiation between sovereign member states, trying to decide how they will work together in the face of the next pandemic. That is an imperfect process in a geopolitically divided world.
Precious Matsotso leads the pandemic treaty negotiations.
We know that every one of you tried to make this work. This is not the end. This is just the beginning.
She's candid about why they failed to reach consensus.
Everyone comes into negotiations with entrenched views and continue to hold on to those entrenched views. And I've tried to kind of cajole them, but also sometimes use a firm hand, you know, to say we're losing out and this window of opportunity is closing.
In tough negotiations, developing countries are asking for more than just quicker access to vaccines.
They said if there's no financing, if we do not have access and benefit sharing, we cannot have a treaty. Technology transfer and local production, they've highlighted that as key.
Global South nations help develop vaccines by participating in clinical trials and sharing samples of disease-causing organisms called pathogens. However, they often can't afford the final products sold by Big Pharma.
Developing countries have been pushing very hard for provision that will help them to do more research and development, actually to innovate and invent medicines and vaccines and diagnostics, to manufacture those products, hopefully at a lower cost. And also, in the event of a crisis, especially in the early days, if, let's say, a company in the United States develops a vaccine, that at least part of that supply would be allocated to WHO to give to the countries that need it most, to the countries that maybe have the hardest time competing in a global marketplace for access to life-saving products. I think behind the acts is a pretty simple principle, which is more self-reliance, actually less begging and waiting for the international community to come and save the day.
In September 2024, delegates agreed to create a system that ensures health experts have rapid access to deadly new pathogens that could cause pandemics. This transactional mechanism could enable global South nations to access cheaper tests or vaccines and commercially benefit from sharing disease data. But how to implement this system so it's fair to all remains a challenge.
Currently, we don't have any rules that obligate governments to share the samples or the data quickly, where all countries say we will all share vaccines, technologies, intellectual property, all of that. And the fact that we don't have those rules puts everybody at risk. What a number of the industrialized countries, I think, are afraid of, and what the pharmaceutical industry is afraid of, is if we allow and build capacity in other parts of the world, those guys are now our competitors. And of course, industry is very happy for governments to try to protect their interests. And so countries that have traditionally been very strong, have had strong pharmaceutical sectors in Europe, in the United States, for example, in the UK, in Japan, they have been very reluctant. They have been hesitant to say, you know, we agree to certain rules that we think might erode some of that economic advantage.
Dr. David Reddy represents Big Pharma, who warned that a rigid politicised system could slow down innovation during pandemics. What are your thoughts on this?
What went well in the last pandemic was very rapid access to pathogens. So any requirements for additional agreements, etc., particularly at time of outbreak, that slow that would be detrimental. And so it's been estimated that a 1 month delay, for example, in access to vaccines would have cost another 400,000 lives during the pandemic. So we can't afford that. There's also an inherent issue around monetizing pathogens, monetizing viruses, the concept of viruses for sale. there's been a request that in order to get access to certain pathogens, that industry should pay a fee. It's an issue because you're asking the pharmaceutical industry to then do the research and development and fund all of it on top of that without any certainty that that will ever be used or be successful. And so you're layering a lot of risk and a lot of cost on top of it.
Some governments say, at the end of the day, we cannot tell a company, we cannot force a company, let's say, to share technology, to teach somebody else, how you make your product. But the reality is that governments can, in fact, put quite a lot of pressure on companies to do that because they are the ones who've paid. That's public money, that's taxpayer money that is paying for the research that allows for a vaccine to be developed and produced by a pharmaceutical company.
In times of crisis, Global South nations believe pharmaceutical companies should be forced to share tech know-how and waive their intellectual property rights to allow local production.
That just won't work because you need to be able to ensure that that is the best approach, that it can't compromise the scale-up efforts that are ongoing by that company, and that the recipient company actually is able to receive, that it has the capabilities, etc., or you can start on a very long road that leads to nowhere. And so this has to be voluntary and it has to be mutually agreed. The key thing is don't dictate to each company which of those things is the most important. Give them the flexibility to sign up and do it in the way that is most appropriate for them.
Well, I was very depressed to see, the Pharmaceutical Association, complaining that the treaty, and the sharing of pathogens and the sharing of vaccines shouldn't be transactional. I mean, what is a pharma company if it isn't transactional? So it's pretty hypocritical if you ask me.
Anti-vaxxer protesters at the World Health Assembly in Geneva have also criticised the pandemic treaty, falsely claiming it gives the WHO the power to impose lockdowns, vaccine rollouts, and control a nation's health policies. Conservative politicians across the Western world have echoed those claims.
Under no circumstances must we surrender our sovereignty in the heat of an emergency. In the real time of a pandemic, there will be irresistible pressure that mounts on a government to make decisions which may well, and as we found, will turn out to be wholly harmful and wrong ones for the good of the country. Will the Minister agree that fundamentally, and to coin a phrase, no pandemic treaty is better than a bad pandemic treaty?
Such critics are against a treaty proposal that rich nations donate or sell a fifth of their vaccine supply to the WHO so they can help low-income nations affected by disease outbreaks.
I think 20% is fair. And that's what political leadership is about, is explaining, the principles by which you're governing. And I think global solidarity should be one of the principles of governance.
Sovereignty is not building walls, shutting the doors, pulling up the drawbridge and saying, we'll have nothing to do with the rest of you. That is not a future for any society.
Vaccine shortages are exacerbating the Mpox health emergency sweeping Africa, highlighting the need for a fairer system. The delivery of life-saving vaccines was delayed for months due to high costs, regulatory obstacles, and reluctance from wealthy nations to donate their supplies.
Pandemics know no borders, If you think that with the resources you have, you can just protect your populace and that you'll be shielded and you'll be cushioned from the outbreaks and pandemics wherever they happen, I think it's a false narrative. COVID did not spare any country. It did not spare anyone. And even the next one, when it comes, it will know no borders. It will not ask for a visa. It will hit like COVID did.
Senegal, a nation left out in the cold during the COVID-19 pandemic, has a lot to gain if the agreement is finalised.
So I think a country like Senegal, a place where you have the existing vaccine production capacity and development capacity and where that's growing, would very much benefit if we have strong provisions in a final agreement that would encourage their government, for example, to make long-term investments in research and development and production.
Boosting local vaccine production capacities will also enhance faith in medicines.
They will be proud of doing something that is local. When they saw that the vaccine is produced in Senegal, the people in Mali or in Guinea are just our friends, our brothers and sisters. So they will say, okay, we can trust that.
A vaccine made in Africa for Africa could not only build trust, but save communities from the next killer pandemic.
And that's the end of the first episode of Flatten the Curve. To watch the rest of our series on pandemic preparedness, go to aje.io/virus. Thanks for watching.